Hello everyone, I hope you had a good long weekend like I did, and here in the United States it was Memorial Day weekend. I used it to great effect. I'll show you some pictures of what I got accomplished this weekend. I both rested and worked really hard, but mostly I needed to recharge because putting these videos together takes a lot of work, and so it was important for me to recharge. And here's how I know that I maybe pushed it a little hard: when I finally granted myself permission to cut back to twice a week. And by the way, these are going to show up on Tuesday, which is today. Today being Tuesday, May 26th, 2020, or day 124 of the total coverage period that we've been putting up here. Yeah, after I gave myself permission to come out with these twice a week, which again will be Tuesday and Thursday. I think I forgot to say Thursday there. I took like 3 naps that very next day. That's something I do. I push, and then all of a sudden, when I give myself permission to rest, boy, I rest up. But that was just one day. The other 2 days were full of work. So let's get into this. I'm calling this one a total lack of common sense. Hello, everyone. This is your honey badger virus update. I am Dr. Chris Martenson here with your update. Let's go right to email of the day. This comes to us from Augusta, Georgia, from Peggy. Says, hello. I accidentally blundered onto your YouTube channel about the time you began your daily honey badger COVID-19 updates. I can't tell you how blessed I feel to have found your site, and it's now the first site I visit every day. I've come to realize that the recommendations you proposed months ago are only now being implemented in this country, and the ideas you put out there due to your extensive research and your own expertise and personal knowledge, as well as plain old common sense, are only now being accepted by both the scientific community and, to some extent, governments around the world. Having practiced nursing for 26 years in a hospital environment, I'm now retired, I fully appreciate the work you're doing. Although I don't understand some of the more technical information you present, I can gather from your explanations the basic premise for your conclusions. They are fascinating and at the same time frightening. We can no longer bury our heads in the sand and just assume that the governments of the world and the worldwide scientific community are only doing good works in their laboratories and promoting research that can only benefit humanity. We now know that's a fiction we will never again have the luxury of taking comfort in. Thank you so very much for opening our eyes and providing us with truth backed up by research and many common sense ways we can and should implement to protect ourselves, our families, and communities, as well as ways to prepare for the future. Peggy, RN, BSN from Augusta, Georgia. Hey, Peggy, thank you so much for writing that in. And I really was drawn to this one. And again, so many great stories coming in. It's so hard to pick one. But I really wanted to focus on this idea of just plain old common sense, because that's really what we're doing here. It's just plain old common sense. And to have common sense, though, which is actually kind of uncommon, you have to have a loose hold on your belief systems. Beliefs are things that can blind you very, very strongly. I believe that the virology community out there that I was battling for a little while, because I was simply daring to ask the question of how can you be so certain that COVID-19 didn't come from a lab, that it was 100% natural? How can you be certain? They couldn't. Scientifically, it was impossible to have that certainty. And so by simply asking some questions, I found myself on the end of ridicule, ad hominem attacks. I got blocked from a bunch of the Twitter feeds when I was trying to discuss things. And I would just keep asking questions like, how did that polybasic furin PRRA site get in there? And how can you be sure 100% that this didn't come out of a lab? And, things like that. Well, that's the reason that I get it. I totally understand. If somebody's entire profession, if their entire professional reputation, if their career, if their salary is possibly on the line, I think you have to expect that they are going to have biases that may well prevent them from seeing things as clearly as they otherwise might. Even in their heart of hearts, get them totally sloshed at a bar, they may well reveal that they have those thoughts, but never in public because, as Upton Sinclair said, never expect a man to understand something if his salary requires him not to. All right, so I want to talk about common sense a bit more, and I really like this part here that about we can no longer bury our heads in the sand and assume governments of the world and the worldwide scientific community are only doing good works in their laboratories and that they have our best interests in heart. So I agree with that, Peggy. So thank you for that email. And you know who else really loved it? That would have been the honey badger virus. Absolutely. Made him dance. So listen, this honey badger virus is so named because it will escape any enclosure. It's really difficult to keep it contained in any way, shape, or form. And I believe that we're about to see it really escape again in the United States. So one of my favorite sayings, though, I found about common sense is this one. Common sense, it's not a gift, it's a punishment. Because you have to deal with everyone who doesn't have it. So at any rate, it's common sense really is actually not all that common, as it turns out. And that's because not because people are ignorant, not because people are intellectually unable to have common sense. It's because common sense requires you to see things from multiple sides. You can't think in absolutes. It's not black and white. This is right or wrong. All that stuff. There's shades of gray, and common sense requires you to be able to see the other side as well as your own side. And that's not something that I think is trained in the educational system in the United States, at least in the public educational level. Honestly, they do train people in elite schools quite often to think for themselves and to see things from all sides. And that's simply part of the process. So let's duck now to the numbers really quick because we got a grim milestone here in the United States, 100,000 deaths. That's a big number that I think you'll see splashed around a lot. These are numbers from today. And the other number I want to sort of begin focusing on is, because I think this is a relative scale for how well a country is doing or how poorly, is deaths per 1 million of population, clocking in at 303 for the United States, 580 for Spain, who had a really tough run of it, 546 for the UK, who continues to have a really tough run of it here right now, in the 500s for Italy, 400s for France, Germany, doing a lot better than its European neighbors, of course, right there. But climbing smartly up the ranks here, Brazil, I believe their numbers are badly undercounted for total deaths, but they are still only at 111 deaths per 1 million of population. In Russia, not sure I trust these numbers either, but also climbing smartly up the leaderboard here, if you want to look at it that way. All right, meanwhile, let's talk about things here in the United States, and maybe it's a metaphor for other countries, certainly not all of them. We're just having a tough run of it here in the United States. A lot of complex reasons for why that is. And here's one of the reasons, of course. I think the battle lines here are really being inked. And Mary Grace, self-described American here, says, it's okay, or I think this is retweeting this. It's okay not to be afraid of a virus with a 99.984% survival rate. And that would be true if that was true, I think. But anyway, a lot of retweets and likes. Again, this is Mary Grace here retweeting this. Came out on May 25th. And just reading through some of the things that showed up underneath that feed, some people who resonate with that message saying, it's the PSYOP panic that shut down the world. Me either. I don't, it's okay not to be afraid. There is no virus. The elite sent millions over the top in the war with a 2 to 3% survival rate. I guess over the top, that's a World War I reference. So I guess that's what we're talking about here. And now want you to hide and stay indoors with over a 99% survival rate and are willing to give you money when you sit at home. All right. Two things. It's possible for this to not be black or white. Either there is no virus or there is a virus. If there's a conspiracy to seize power, or there's no virus. Listen, it can be both, right? There can both be a bad virus, and it can be the governments or staffed with managers are doing a really particularly poor job and doing what they always do, which is to seize more power and to reward themselves. You watch what the Federal Reserve is doing in the United States right now. The U.S. stock market again is up. I don't know. Last I checked, maybe 600-700 points for the Dow, just screaming higher, everything green, billionaires becoming more billionaire. Why did they do that? Why would the Federal Reserve just keep pumping the stock market up? Well, it's because it's all they know how to do. They're just poor managers, right? A leader would understand the sociological impacts of that, the long-term impacts of that, would understand where we really were in this larger story of resource depletion in the world, and would understand that exactly the things that the Federal Reserve is doing right now by creating a wealth gap and all of that, a leader would say that's a terrible thing to do. But the Fed thinks it's a great idea. Why? Staffed with managers. So it's possible to have really crappy managers and a really crappy virus at the same time. It doesn't have to be either or, but I see the battle lines being inked here. So first thing up, this whole idea of a 99.98% survival rate speaks to the educational system here again, I think, because a curious person would say, is that true? because that sounds, 99.98. That's really high survival rate. Let's be really clear. Mortality is the percent of the population that dies from something. So that's very different from an infection fatality rate, which is the percent that catch it and die. So just to make it simple, imagine the infection fatality rate is 10% and half the people actually get the infection. The mortality then would be half of that, right? Because half the people didn't catch it, half did. And of the people who did, 10% died. So it would be half of 10%. So if the IFR in that little scenario I just set up was 10%, the mortality would have been 5%. The case fatality rate, the CFR, is the percent that presents to the medical system as a case that end up dying. All right. These are three very different numbers. I'm not sure what a survival rate is, but it has to be mortality, I guess, is the closest thing. Otherwise, the idea, a survival rate would be of the people who catch it, 99.984% survive. And that's absolutely not the case with this. That's totally debunked. That's actually completely fake information right there. Because we know that the survival rate is actually much lower than that. So it's still a pretty good survival rate, but that is not that. All right. And I'm kind of at a loss for words. Everybody saw this, that Lake of the Ozarks. These are all people here on Memorial Day weekend, obviously not engaging in social distancing. I've seen the drone footage from above, so this isn't a trick of the old telephoto lens like we covered before. And secondarily, I can't find a single mask in this picture anywhere. So no masks, no social distancing, nice and close to each other. Probably some coughing going on, because you know how it is when you go underwater. Sometimes you sputter a little bit. But what's interesting is the Missouri health officials are calling for self-quarantine of partiers at Lake of Ozarks. I'm going to bet that's not going to work out. Calling for a self-quarantine on these people with this level of self-awareness around the virus, probably not. Moving on, here's what's passing for logic right now out there. And let me make sure I put this in. Passing for logic. Check this out. This is good logic. I didn't show you how many times this had been. A lot of people liked this and said, yeah, I agree. Jordan Rachel asks, if the masks work, why do we need 6 feet? If the 6 feet works, why do we need a mask? Seems like airtight logic, doesn't it? Because I think the implication is that you're being lied to. And what Jordan here is not understanding is that it's a combination of things. And so we'll get to that in just a second. So here's somebody underneath this thread here, Dave Rills, repeating this, saying, if the masks work, then why are we social distancing? If the social distancing works, then why are we wearing masks? If masks and social distancing work, then why are our businesses closed? All right. This one is actually a reasonable question right here, except no, we aren't wearing masks and having social distancing. Well, here in Massachusetts, Western Mass, everywhere I go, everybody is wearing a mask. The only two people I've seen without wearing a mask happen to be around 70-year-old dudes. So something about the old guy syndrome seems to not work. But otherwise, we are like 99.95% masked up here. Everybody I see is masked up. And the businesses aren't closed. So that's pretty awesome, right? So that's part one. But part two is not every business is, even if you have masks and social distancing, is going to help. Like a gym where people are all touching things. That's a harder thing to reopen. Or going to a place where there is more of a chance for people to circulate the virus in and amongst each other. Okay. Wayne here writes, faux science, simple as that. Face diapers are a simple symbol of compliance. That's Wayne, you face diapers. You really, what a zinger there. You think you've displayed where you are on that. Recovering liberal here writes, I tried asking this of a healthcare professional, and he said, you're just being a troublemaker. No, I wasn't. I was just trying to understand. So in the interest of understanding, let me help. It works like this. Let's say that masks reduce our chances of spreading and or catching the virus by 80%. That's about what the data says. If we could just get about 80% of the people wearing masks, we would drop the entire spreading of this infection by about 80%. Remember, this is an asymptomatic spread, okay? So spreading disease. So at any rate, that's your first 80%. And then if you keep that 6-foot minimum distance, maybe that, I'm just making this number up, but it drops it by some percentage. So social distancing really does work to help keep this virus down. Why? Because the chance of catching it is a function of two things: the load coming off the person and your distance from that, your proximity to it. So if somebody's shedding a very high viral load, every foot closer really increases the amount of that virus that you're being exposed to. So I just make this up, but let's imagine that keeping 6 feet apart reduces your chances by another 50%. This leaves your total chance of catching it at 0.2 times 0.5, okay? So that leaves just 0.1. So with masks and social distancing, that's why we do both, we might only have a 10% chance compared to without. So without both measures, you have 10 times the chance of catching COVID-19. That's why, Jordan, we would do both the mask, ding, and the distancing, ding. Those two things would be important. All right, remember last time, which was Friday, which was 3 days ago now, we talked about this Lancet study that came out, hydroxychloroquine or chloroquine with or without a macrolide multinational registry analysis. Remember, this isn't a study. They just went back in and they dug through the data, but they forgot to ask anything about zinc or zinc levels, and they didn't control for timing. That is, they kind of proved something we already knew in this study, which was that if you start taking hydroxychloroquine after you present with serious symptoms to the hospital, it doesn't really work that much. It's kind of like deploying airbags after the car has already crashed. Doesn't really work all that well, right? It's putting the condom on after the pregnancy happened. Doesn't really work all that well. So that's that we pulled that study apart. I didn't really want to read all the pages and go through all the tables, but you know who did? W.H.O, who's the French professor who's been very actively promoting hydroxychloroquine to apparently great effect amongst his patients. He wrote here about the paper published in The Lancet, data coming from 5 different continents cannot be so homogeneous. There is either data manipulation, not mentioned in materials and methods, or incorporation of faked data. So he's saying this data manipulation, I think this might be a little translational. He's saying they either did something to massage the data, control for it. They did something to it that they didn't talk about in their materials and methods, or it's fake data. Thank you to Jim H. over at Peak Prosperity for raising my attention to this particular tweet by W.H.O. And so I looked in here and I looked at, so here's all the summary data by continent, and it's talking about all the different variables here that they looked at and that they were going to control for. So, and how many? 63,315 from North America on through. You can read those numbers right there, right? But these are thousands and thousands of people. So the law of big numbers takes over, and everything should be right around the averages you expect. Here's the age and the body mass index. And what he's noting here is that there's something is just too homogeneous. So let's just pick one of these out. He circled a bunch in red. I just want to look at this one for current smokers. Look at this. 10%, 10.0 in North America. 9.7 of all patients presenting were smokers in South America. 9.7 in Europe. 10.3 in Africa. 9.4 in Asia. 10.0 in Australia. All right, that does jump out, Didier. You're absolutely correct. There is something wrong with that data, and we can. Here's a simple example of this. This is North America, which consists of the United States, Mexico, and Canada. And as of 2016, in the United States, 21.8% of people smoked, 14% in Mexico, 14% in Canada. So I'm not sure how you got to a 10% average of people who are presenting. We'd have to assume that smoking confers some protective benefit, I guess. But Australia has a 14.7% rate of smoking. It showed up with a 10.0. And Germany, this is Europe, all these bright reds right here, the darker the color, the more people smoke. But Europe is somewhere between 20 and up to 30% of adults smoke. And we look at Europe, 9.7. How are all these numbers so close, right? I don't get it. 10% in the United States, 9.7 in Europe, 10.0% in Australia. This just doesn't, This is odd. Okay. So that's just a little bit odd there. But at any rate, this Lancet study comes out and it impacted a lot of things. And of course, it became a political Rorschach test in the United States with people either saying, "Ha, showed you didn't work," and guess what? They tend to be more Democratic leaning, and a lot of people saying that's bunk. Study was done poorly, and they could fall either on the more Republican side or, in this case, I'm neither. Remember, I don't care. I don't really care left or right. But for people who are like, yeah, it was kind of a bad study, but it doesn't matter because the WHO, W.H.O, not who, the WHO is a great rock band. The W.H.O, who I think very poorly of. I think there ought to be mass firings there at a minimum. I think that they owe the world a gigantic apology, and I think they ought to outline how they're going to do better next time. But they're trying to skate past this whole thing, doing some revisionist history on their part as an organization. So, hey, their choice. This comes from Monday, the 25th, yesterday. WHO halts hydroxychloroquine trial for coronavirus amid safety fears. Read down into this article. It says the WHO's Director General Tedros said in light of a paper published last week in The Lancet that showed people taking HCQ were at higher risk of death and heart problems than those who were not, it would pause the HCQ arm of its Solidarity Global clinical trial. So it's pausing that. So they're going to run all kinds of other stuff. Remdesivir, they're going to keep running that arm of it. But HCQ, nope, they're stopping that. And so this is the impact of all of that. And remember, this paper published in Lancet, remember its prime conclusion? It said, hey, you really, they did have a disclosure, which was fair. They said, we've dug through the data, but you know what? You can't use this data to make clinical decisions or to draw a direct cause and effect between outcomes and the use of this drug. Why? Because they didn't control for timing and all sorts of other things like that, right? So something's really weird in that data anyway. Doesn't matter to the WHO. They suddenly dropped this study. And meanwhile, we've just got this anecdotal evidence. It's super strong. So let's just look at one of these that came up, and we talked about this in April when it came up. So there was this Texas nursing home, and they just jumped on the idea of treating their patients with HCQ, right? And they used HCQ plus zinc plus azithromycin. This is the full thing that we would expect, and they did it early as they could. This is an experience of a lifetime, said Dr. Robin Armstrong. This is something we'll probably never experience again. Dr. Armstrong and others at the resort at Texas City Nursing Home knew time wasn't on their side. 2 of our residents had symptoms, and that's when we tested everybody. That's how you would do it. 56 residents, 33 staff members were COVID-19 positive. You've seen this repeated in nursing homes all over the place. This is a disaster unfolding. We know how this story ends, don't we? If we didn't make the decision quickly, then we could potentially lose 15 to 20% of the residents, which was not an option, said the good doctor. Armstrong's approach was to begin administering HCQ, a Z-Pak, and zinc just as soon as a resident first started showing symptoms. Oh, zinc. As soon as a resident first started showing symptoms. Ding! Get a check plus on that one. Love it. All right. The patients were being monitored daily. We did EKGs on each of these patients to make sure they didn't have cardiac side effects that everyone talks about. None of our patients did. Armstrong doesn't call HCQ a cure and is aware of all the recent reports that say the drug shouldn't be used, but he points out that only one of the nursing home's COVID-19 patients has died. Everyone who got on treatment, who started on treatment, is actually doing really well. 1 out of 56. Let's come over here for a second. 1 death out of 56 patients is a 1.8% rate of death. So that's a case fatality rate right here, 1.8%. 99% of the staff stayed, so they stayed in the home. Actually, we had 34 employees that contracted the coronavirus, all lived. 98% are back at work right now. Okay, that's pretty good anecdotal evidence. Now let's contrast it to other anecdotal evidence, which says nursing home COVID deaths are actually the vast majority. This is us looking at a map of the United States saying what percentage of any given state's total deaths are due to nursing homes. And you can see here, Massachusetts at 77%, 81.4 up here, 61.1 over here, 63.3. But generally speaking, at least a quarter and up to 80% of all the deaths in any particular state are due to nursing home deaths, okay, or assisted living facilities. So that's the data. And she's saying, well, how is this data so different? And let's look at some very different anecdotes here. 36 residents up here in this New York State nursing home have died in this East Aurora thing. With respect to nursing homes, Massachusetts has unfortunately evolved into a national hotspot. Let's look at this. As of Monday, 10,031 residents and staff at all these different residences, 93 rest homes, have tested positive. So 10,031 have tested positive, and 56% of the state's 2,899 coronavirus deaths have been residents at nursing homes. So let's do the math real quick. 56% of 2,899 equals this number, 1,618. And then if we divide that, 1,618 deaths, that's the share of deaths that would be due to nursing homes. And we divide that by the total number of people tested positive at nursing homes, we get up with a 16.1% fatality rate. Nobody here was using the HCQ protocol here. Let's also turn now to some other anecdotal data, such as, Malaysia. Malaysia uses hydroxychloroquine as a frontline treatment, thanks to Malaysian Prepper. Thanks very much for drawing this article to my attention, which is this one right here. It says, thank God Malaysia's using HCQ correctly, even though missing zinc, for the right reason, early stage COVID-19 infection. And continue to use even though the WHO suddenly found 40 years of old medicine having dangerous side effects. I agree with that. It's just crazy. This is crazy. It's insane. So here from today, the health director general said the ministry will still cautiously administer the anti-malarial drug called HCQ to treat COVID-19 patients at its hospital. So people are all asking, oh my God, there's this Lancet study that proves how dangerous it is. So here you see the health director in Malaysia saying, we're still going to cautiously administer it because they have to. That's the game you have to play here now. The WHO has revealed that it had paused trials into using HCQ to treat COVID-19 as the drug may cause side effects such as irregular heartbeats, headaches, blurred vision, and muscle tenderness. Are you kidding me? You're worried about a headache? People are dying. They're ending up with permanent lung damage. Blurred vision, permanent lung damage. Muscle tenderness, they have lifelong kidney damage. It might be. Irregular heartbeats, I'll take that over a coffin any day. I mean, I can't. Oh my God. At any rate, let's continue on here. Malaysia, by the numbers, look how they flattened out their total death line here. You see that? Oh, it's getting really flat there. Okay. So that's what you can see with your eyes there. But let's go to the actual numbers here and note that Malaysia's had 7,604 cases and that their total deaths per 1 million of population stands at 4. What about Costa Rica? They're known to use a lot of hydroxychloroquine. They, too, had to come out and say, we're going to reevaluate the use of the drug. Roman Macaya here, executive president of Costa Rica's Social Security Fund, acknowledged the HCQ news and said Monday that the country is convening an urgent meeting of its experts to determine next steps. At the same time, Macaya said Costa Rica has used HCQ differently than what was studied by researchers who analyzed all these 96,032 patients in that Lancet trial. In Costa Rica, all patients, including those with minor symptoms or who are asymptomatic, are offered the option to take HCQ upon their diagnosis as long as they don't have contraindications to the drug. Costa Rica has a low case fatality rate, 1%, 1.07. And fewer than 5% of known active coronavirus cases are currently hospitalized. We can't say that's a result of this medication, but we can't discard it either. And let's look here. Costa Rica, low number of total cases, but only 2 deaths per 1 million of population. So that's where the anecdotes take us. That's where the countries that are using it, the nursing homes, all of that are using it, they have these really ridiculously favorable rates of infection. And this is how we get back. If you said, I'm so disappointed, I don't want to wear a mask, I don't want to do social distancing, I want to get back with life, that's fine. But if we actually had proper social distancing, proper mask usage, and proper treatments that could legitimately control for and give us frontline treatments that could take the actual case fatality rate down to 1% or less, right? That's a whole new world we get to inhabit. We learn to live with that additional risk. People with comorbidities may decide to go through additional distancing and all that. But the rest of us can get on with our life. But we can't be knuckleheads about this. And unfortunately, the state of the conversation is pretty knuckly at this point in time. So these are strange times indeed. This is me taking a walk with my mom. And that's Evie, my fiance. And we are out walking around in beautiful nature with masks on. You know why we do that? Because the honey badger virus, it just doesn't care. It's just if we let our guard down, it will get us at some point in time, just because that's how it's built. Remember, you want to take all your immune boosters to treat the terrain so that if you do get it, you're going to have a much better run of it. All right, conclusions for today. People in the U.S., we've just lost the plot in this country. I don't know what's happening here, but common sense ain't part of it for a lot of folks. And there will be other waves of the virus unless something really has changed about the virus. I'm not sure that's the case. But social distancing for people, well, that's just out the window. Masks, can't be bothered to even self-educate about them. Countries such as Malaysia and Costa Rica with a frontline use of HCQ seem to have very low death numbers per million of population. That speaks something, I would think. The Texas nursing home anecdote and a dozen others, just like it, add up to a compelling argument for running a proper study. Please, can we just have a proper study, not a retrospective study where somebody's pawing through data and you get these mysterious things like, why is everybody have the same rate of smoking across 5 different continents? That's kind of weird. Look at this hypertension, 27.1, 26.7, 26.4, 25.9, 26.6, 29.4. Really? That's a really consistent rate of hypertension across such diverse cultures and continents. That's kind of weird, right? So if we could just get proper data, I think we could get on with life. So we need that proper study. In the absence of that, though, even if we didn't have it, why not use it when you see the anecdotes like the Texas nursing home, Malaysia, Costa Rica, et cetera, and so forth? I don't get it. All right. Remember, if you want to learn about what the Federal Reserve is doing, by the way, they are playing with fire, social fire, future fire, and they're burning our future right in front of us right now. You should watch this. This is our What the Fed, our second seminar on that. Really good webinar. That's an awesome one. And remember, plant a garden. Here I am in my new garden, planting, in this case, these are cabbages. And here you can see some kale up front. And this is what my new garden looks like. And by the way, this was just a bare plot of ground just a few days ago. So this is the result of a weekend of work. That's what I was really doing Sunday and Monday of this weekend after I slept on Saturday. Had some help from some of my good friends, Tim, Jason, of course, Evie. We were all out in the garden at appropriate distances and worked very hard to get it into this state. So plant the garden. You're going to love it, and it's going to keep you healthy and happy. And hey, you may actually really need the food at some point in the future. Who knows, right? All right, that's all I got for today. Thanks for listening. Take care. And remember, Tuesdays and Thursdays, I'll be back with you on Thursday of this week with another commonsensical update. Thanks for listening.
WTF, What the Fed, Round 2. Last time we were together, we were very concerned because the Fed had added $200 billion to its balance sheet. Little did we know, a few weeks after we chatted, the coronavirus exploded across the world. And in response, the Fed and the world's central banks have now been printing trillions and trillions of dollars, making the magnitude that we were concerned about look positively quaint.
Isn't it optically awful that Bernanke, the past chairman, went to join Citadel, which was one of the first entities to receive a bailout? What hasn't changed would be an easier question, because so much has changed at this point in time.
1 in 5 of the workforce in America has lost their job in the last 6 weeks, and the market has gone up. We've had unemployment jump to 14.7% from 3.5%, and the market has gone up. We've seen consumer credit and consumer spending collapse to all-time lows, and the market has gone up.
Every emergency effort to save the system makes it more fragile.
The data is suggesting that there isn't any way out of this except to print the dollar into oblivion.
They're picking the 0.1% and the 1% over everybody else again.
This deflation will continue for a while, but then there's going to come a day where all of the currency printing comes back with a vengeance. We are now witnessing the death of this currency system.